Oklahoma has just about every kind of worker shortage you can imagine right now. Teachers and nurses, law enforcement, engineers, you name it, and we need more of them, including EMTs, emergency medical technicians. Now, thankfully, we don't have a shortage of reporter Steve Shaw, who joins us now to discuss what's being done to help alleviate this problem. Steve?
Rich, right now, you can make a higher hourly wage working at a convenience store than you would as a licensed EMT in many places around the Sooner State.
Hold on, we got to tie this down.
A few months ago, Chris Prutzman was working retail sales in Oklahoma City.
I've got an eye on it, so if you come around.
Then he followed his heart and signed up for the Emergency Medical Services Authority, or EMSA's, new accelerated emergency medical technician training, which lasts 12 to 14 weeks. EMSA supplies EMS service to Tulsa and Oklahoma City.
You get to contact so many people and affect so many people's lives, and that's what I kind of enjoy about it.
The deciding factor that propelled Prutzman from retail to this new career is pretty simple. Next week, as part of National EMS Week, EMSA will announce for the first time they're not only offering an in-house EMT training program, EMSA is now also paying the Chris Prutzmans of the world $13 an hour to do it.
Yeah, a big deciding factor was that they're able to pay you while coming to school. You know, I mean, I'm fortunate enough to be able to come to this program, and I don't know if I would have been able to do it without them being able to financially support me through this education process.
Let me throw some numbers at you that are ominous, if not stunning. According to the National Association of EMTs, in 2020, there were 58,000 newly certified EMTs and 9,000 newly certified paramedics in the U.S. 1 year later, there were only 4,200 newly certified EMTs and a paltry 470 newly trained paramedics nationwide. There is one catch to EMSA paying EMTs to train. In return, those trainees have to sign a contract to work for EMSA for 18 months once they're certified.
We are putting our faith behind their desire to be an EMT, to help our patients, to be a first responder in our community. So we think it's only fair that we have a mutually beneficial partnership as we put these EMTs through EMT school.
Spokesman Adam Palukas says starting EMSA EMTs make around $14 an hour. Their EMTs work 4 12-hour shifts a week, which means 8 hours of overtime pay is built into their weekly schedule. And there are other opportunities for overtime pay as well. But Palukas says the most important thing right now is they just need more people with the passion to do this.
They've had long shifts, late calls. It's our responsibility as an organization to try whenever we can to increase our numbers so that our EMTs and paramedics can feel some of their load lighten. So that's why we leave no stone unturned. We're doing digital recruiting. We're having our recruiters go to schools that they've never visited before in Texas and other states. It's why we're doing social media ads. We've never done social media ads, but we're meeting people where they are. We're not going to put an ad in the classifieds anymore because young people who make up the bulk of new hires in EMS aren't reading the classified ads. They're on TikTok or Instagram or Twitter. Right now we have a lot of money that we're not spending that is earmarked for salaries. So we'd much rather invest that money into building our workforce than just let it sit there, because we have an obligation to the citizens in the cities that we serve and our patients to make sure that we're staffing our trucks and to make sure that we're out and available.
And we go, we're just guided in. Now,
over at Metro Tech in Oklahoma City, EMT candidates have been training at Metro Tech's Skills Lab every Saturday since early March.
Public service has always been a passion of mine and always been an ultimate career goal of mine.
And you, it speaks to you.
Yes, sir. So, especially in the day and age that we live in right now, and everybody needing, help and everybody hurting in some way, especially with the pandemic and all. And I just want to be there and do what I can and do my part to bring hope to the hurting.
The pay is not ideal, but sometimes there's definitely more important things than the pay. I mean, it's a field where you need help. You need EMTs, you need, intermediates, you need paramedics, and it's a field that you've got to have the heart for it, because if you don't have the heart for it, you're not going to stay because of the pay.
We need more people on the streets. Our healthcare system is actively collapsing, and we're trying to fill that need to get more staff out there to help with that.
Metro Tech hasn't done this class in 12 years, but the need dictates they had to do it again.
Those Metro Tech classes cost $800, which Workforce Development Coordinator Jason Langford says is about half what other programs cost. And he says if you're a military veteran, you get this training for free.
We used to staff paramedics or ambulances with a paramedic and an EMT. Now most ambulances in the state, even in the metro, are sometimes staffed with 2 EMTs because we don't have enough paramedics to staff every ambulance.
Bill Worden is medical director at the Logan County Sheriff's Office, as well as 115 other rural health care agencies across the Sooner State. Besides the recent pandemic, he says a key factor driving our current predicament is that Medicare and insurance reimbursement over the years has declined.
It's multifactorial for sure, and it's something I think that all of us need to work on with not only our state legislators but our Congress and Senate to increase reimbursement with the federal programs and our insurance companies to make sure that they're paying the premiums that you as a consumer are paying needs to be used for health care, not the stock market or investors or the CEOs. That money needs to funnel through and go back to the providers that are providing health care that you paid for and expected.
From what I gathered, paramedics generally make around $10 an hour more than EMTs in Oklahoma, but they also undergo at least 10 months more of training.